And we're joined by two doctors who see this problem firsthand, and they're studying what's behind it. Dr. Camilla Premji is a family physician and an associate professor at the University of Ottawa, and she was with us on Cross Country Checkup earlier today on CBC Radio. And Dr. Rita McCracken is a family physician in Vancouver and an assistant professor at UBC's Department of Family Practice. Welcome to both of you.
Thank you.
Dr. Premji, we had a lot of callers on the radio talking about desperately seeking a family doctor, and you're seeing that every day. Tell us about that.
We did, and yes, it is reflective of what I'm seeing every day. I've been in practice for about 15 years now, and I used to get maybe 3 or 4 requests per month to take on new patients, even after my practice was closed. But now I'm getting those requests every day from patients, from family members, from friends. People aren't able to find a family doctor when their doctor retires or when they relocate to the area I work in, which is Ottawa. And it's becoming increasingly obvious to me that there is a major shortage in our community.
And you know what the data says about the lack of a primary care physician for people, the bad health outcomes that follow. So what's it like when you have to tell them, listen, I just don't have any room to take on any more patients?
It's heartbreaking. I hate having to say no. I know that, like you said, that it is better for the patient's health and for the health of our system overall, for people to have access to a family doctor, and to say no is so difficult, but I'm at capacity and have no choice. But on top of the knowledge of the negative outcomes for people who don't have access to a family doctor, it takes away some of the joy of practicing family medicine when I don't have capacity to take on the family members of my patients. I went into practice to follow families, and to not be able to do that to the same extent I used to is difficult.
Dr. McCracken, I know this is a big question, and I'm sure the answer is complex, but I do want to ask it. Why are we seeing this acute shortage in family doctors in Canada?
Yeah, so this acute shortage is actually a problem that is just getting worse. For at least 20 years, there's been 15% of Canadians who haven't been able to find a family doctor, and it has gotten significantly worse recently. A big part of why we've had this consistent problem and why it's getting worse is how primary care is structured. So imagine if our public education system was structured where teachers needed to start their own schools, and then we paid them per student per lesson. And that is essentially how we have structured primary care right now. So number one, we probably don't have enough family doctors working. But number two, more importantly, the people who we are graduating who want to do family medicine don't want to work in that environment. And they are choosing other important jobs within the healthcare system where they can have a well-supported environment, be able to take a vacation, have a baby, that kind of thing. So our solutions need to be focused on infrastructure.
And Dr. Premji, you talked about a potential solution on Cross Country Checkup earlier today that involved various healthcare providers working together. Tell us about that.
Yes, the management of patients has become increasingly complex in family medicine, and it really isn't sustainable to expect family physicians to provide that care at the high standard that we should expect all by themselves. What we need is for every patient and their family physician to have access to a team of healthcare professionals, people like nurses, nurse practitioners, dietitians, social workers, physiotherapists, mental health counselors, administrative supports, all working collaboratively together. And there is a model of care like that was rolled out in Ontario in the early 2000s, mid-2000s, called the Family Health Team. That model was frozen, and very few patients in Ontario now have access to that model. And it is very limited in its availability in other provinces across Canada as well. But that could be one part of the solution and a major part of the solution.
Dr. McCracken, at UBC Medical School, presumably there are still lots of young students who are getting into family medicine. Give me a sense of what those conversations are like when they say to you, do you recommend this as a future for me?
Well, so my direct involvement with students, I'm always very encouraging around family medicine, and I emphasize the ability to find a path that is going to work for them, which I think most Canadians are looking for in a job. They want a job where they feel good about the work that they're doing, and family medicine certainly provides that. There are many options. However, the reality of how we are, the jobs that we're structuring in community-based longitudinal primary care, which is the care that Dr. Premji referenced, that increases population health and also reduces costs overall, it's becoming less and less attractive because we haven't updated the system of work structure since Medicare started between 1960 and 1980. And so what I hear in the research